The COVID crisis in China has taken a worrying turn now. According to a UK research firm, Airfinity, more than 5,000 people are probably dying each day from COVID-19 in China. The firm has used modeling based on regional Chinese data to produce these figures. The data has also put currently daily infections in the country at above 1 million. Now, it is pertinent to note that the Chinese media has a completely different picture to present, and as per China's official data, the country has reported 1,800 cases and 7 deaths over the past week. Now, as per reports, acute shortages in ICU beds, ventilators, medical supplies and doctors are the main challenges that the Chinese government is finding hard to overcome. So, we have this news coming in from China where there is a massive surge in cases of COVID-19, and now, according to a UK research firm, Airfinity, more than 5,000 people are probably dying each day from COVID-19 in China. The firm has used modeling based on regional Chinese data to produce these figures. The data has also put currently daily infections in the country at above 1 million. Now, it is pertinent to note that the Chinese media has a completely different picture to present. My colleague Shireen joining us to give us more details. Shireen, what is the difference between the actual figures that China is reporting and the figures that China is claiming that are coming every day in the country?
Well, the fact of the matter is that it is in fact very difficult to determine what is really happening in China at the moment, because WHO has also in fact raised concern that why is that China is not really releasing the real facts which is happening. Because if you see the last statement also that has come from the China Health Commission has also in fact said that there are only about 50 deaths that has happened so far, and about 1,800 people are infected. So this is the account that is being given by the official Chinese government officials. But as far as this particular UK firm, which is in fact a health data firm which looks into the data, which does the mathematical and scientific, based on mathematical and scientific evidence, they have in fact found that more than 5,000 people have in fact died overall now in China, and the number are only going to rise. So this is of course a concern globally, that is in fact a concern now. The WHO has also asked China that they need to come out and give out the numbers, but China has in fact been downplaying is what the allegation that is coming in from the different countries. Also, we have seen that the reason the experts have been saying that why China is facing this situation at the moment is because of their reverse vaccination program. When we talk about India, we started the vaccination program with the elderly. People above 60 years of age were first inoculated, and then the younger population was inoculated. But in China, the younger population was the first who were inoculated with their vaccines. And we talk about their vaccines, be it Sinopharm or be it Covovam. These two vaccines, the efficacy of these two vaccines are not good enough is what the experts have also been suggesting. Their efficacy wanes in months altogether. But when we talk about our vaccination, be it Covishield, be it Covaxin, our efficacy is in fact been doing really well, and the precautionary dose is also something that people are taking now, though the coverage of the precautionary dose is around 27 to 28%. That is something that the government is planning to ramp up. But China at the moment, the need of the hour for the entire world, the need of the hour is that China actually comes out with the real facts, that how many people are actually affected due to COVID, how many people have died, because BF7 is a variant that is now being found in Japan, Korea, US as well as in India. There are 4 cases of BF7. So accordingly, it becomes very important that the world gets to know the data, the death data, the COVID data in China. But the China officials are downplaying is the allegation that is also coming from the WHO at this moment.
All right. Thank you for giving us all those details.